Welcome back to your hometown news. With the change in seasons could come a change in sleep patterns. And here today to talk to us about how important it is to get a good night's rest is Dr. John Penek. He is director of the Sleep Health Institute at Chilton Hospital. He's been in this industry for 30 years. He's a pioneer in sleep medicine and past president and co-founder of the New Jersey Sleep Society. John, thanks for joining us.
Oh, you're welcome.
So why don't we talk first about just how important it is to get a good night's rest?
Very important. In this day and age of hyperactivity and decreased sleep, we suffer physically and medically from decreased sleep. We should get 7 to 8 hours of sleep a night. Most of us don't. And we develop a sleep debt, just like you develop a credit card debt. And that catches up to us. Sometimes we catch up on weekends, sometimes we don't. But it's now proven that there are considerable health consequences of poor sleep.
In fact, researchers at the Massachusetts General Hospital and the University of Pennsylvania recently found a correlation between poor sleep habits and memory impairment. The findings presented at the Neuroscience 2012 conference show restless and choppy sleep can put you at a risk for Alzheimer's disease or severe memory impairments.
And actually, total deprivation of sleep is not compatible with life. They've studied this, of course, not in humans, but in other lab models. And it's important to get an adequate amount of sleep every night.
Now, you always hear about people having these IOUs, I didn't get enough sleep Tuesday, so I'll make up for it on Friday. Is that something that's effective? Does that actually work?
It can, but it's better to have a fairly fixed sleep schedule. Go to sleep at a certain time of night, get up at a certain time. Growth hormone, which is important in terms of adolescence and children and growing, is secreted during the first hour and a half of delta sleep. And that gives new meaning to when our mother used to say, get to bed on time so you grow up to be good and strong. And we don't know, but when we presume that the growth in terms of height and maturation will be retarded by poor sleep quality.
So we all know that when you don't get a good night's rest, you feel like a zombie, you can't focus, but there are some more serious side effects to not getting enough sleep. Can you talk about that a little bit?
Sure. There are now over 80 identified sleep disorders by the American Academy of Sleep Medicine, the most common of which is sleep apnea, snoring. Next, more common is insomnia, but there are some really bizarre sleep disorders that are not well known, fortunately. Something called fatal familial insomnia. These are people who, and we don't know the mechanism, get to their mid-40s and cannot sleep, and then they end up dying in their sleep. And it's universally fatal. It runs in families. There's other sleep disorders, periodic limb movement disorders, leg movement disorders, conditions such as narcolepsy, where people fall asleep involuntarily. So there are numerous sleep disorders that we've now recognized and are well documented.
Here at Chilton Hospital, you have the Sleep Health Institute. Why don't you tell us a little bit more about it?
It's a 4-bedded lab. We do 4 studies a night. It's accredited by the American Academy of Sleep Medicine, which is a rigorous accreditation process we've gone through twice now. And we have trained technicians that are licensed in the state of New Jersey to administer sleep studies. And the patients are referred in either by myself or other sleep physicians. We have a total of 6 other sleep physicians on the staff here.
So let's go take a look at that sleep lab and see exactly what you're talking about.
Be happy to.
More than 10,000 patients have been treated through these doors since the program's inception. Chilton's Sleep Health Institute has 4 private rooms for patients who stay overnight for 7 to 8 hours. It's designed to make patients feel at home. Dr. John Penek has directed the center since 2004 and helped set up other centers around the state. He showed us what happens behind the scenes from the medical side.
What we're looking at here is the results of the polysonogram, 13 different channels we're measuring, including all kinds of parameters that are important for us to evaluate the quality and the stage of sleep. And we're also looking at a video monitor that's done through infrared cameras. This is the control room. It's like the control room of the Starship Enterprise. This is where the technicians sit at night and observe every breath during the sleep test. This is called an epoch, which is 30 seconds of sleep. And of course, there's 2 of these every minute. And when the technician goes through this on the following day, they look at every breath to look at the activities. People breathe 12 to 14 times a minute. And we're also looking at a video monitor that's done through infrared cameras of the patient sleeping. The technician watches both. We can tell by the frequency of these brainwave activities that this patient is still awake. It's called alpha rhythm. And you'll see a change in a few minutes as I go down. This is leg movements. This is EKG. This is the stage of sleep. This is snoring. And there are 13 different parameters we measure.
So when the lines are more straight, that indicates that they're sleeping and they're at rest.
Exactly. Now we're getting into much deeper sleep here. You can see the waves are getting bigger. This is delta sleep, which is what we call slow wave sleep. The patient just woke up there for a second.
Ah. Now, can you see nightmares in this thing if someone has a nightmare?
Cannot.
Okay.
Nightmares are characterized coming from REM sleep, dream sleep, frequently scary. Person wakes up, remembers the dream, and goes back to sleep. Night terrors are different. They occur during non-REM sleep in children, and it's actually not waking up completely. The kid arouses from a slow wave sleep and screams inconsolably, scares that bejesus out of the parent, of course. The child never remembers the next day. Sleepwalking is another issue, which occurs during non-REM sleep. It can be a big problem. People can fall off of banisters and so forth.
There are more than 80 sleep disorders identified by the Centers for Disease Control. Studies have shown that obstructive sleep apnea increases the risk for many cardiovascular diseases, including heart attack and stroke. It also has recently been linked to a heightened cancer risk. Problems ranging from snoring to regular movements like leg kicking can be a sign that something's wrong.
So if I'm someone that's not getting a good night's rest, how do I know if I might have a sleep disorder and should get it checked out?
Well, there's hints of being chronically fatigued, a bed partner or a spouse or a family member or a parent saying that you're snoring or moving your legs during sleep. All these things are hints, but the best thing to do is to see a sleep professional. We have at Chilton screenings in the evening where we call it a screening where people can come in and meet with me and another sleep professional and talk about their problems, and if it's deemed necessary, be scheduled for an overnight sleep test. We do sleep tests here 7 nights a week. Patient comes in about 8 o'clock at night to our sleep center. This is one of the rooms, and is hooked up on a monitor that measures a polysonogram, many body measurements.
Nowadays, how do you treat sleep disorders?
Depends on which one it is. Sleep apnea is treated by either a dental device that goes in the mouth and advances the mandible, or nasal CPAP. Sometimes sleep apnea only occurs while sleeping on the back. If we can identify that, we can change the sleeping position. As far as insomnia, there are various techniques that we use to teach people better sleep habits, avoiding of caffeine, chocolate, things like anisin and etc. contain caffeine, getting to bed at a regular time. There's always a way of treating it, and sometimes medications are necessary as well.
Now, right now, I understand between now and December, you have a couple free sleep disorder screenings that you're offering?
We have 2 a month in the evening, generally, sometimes during the day, but in the evening people access better because of work. And we meet at one of the campuses of Chilton Hospital at 6 p.m. I know that Monday we have 8 patients, potential patients scheduled to come in. They usually bring their spouse, because the spouse is a better witness to sleep problems than the individual themselves because they're asleep. And they come in and they discuss their problems, and I examine them and decide whether a sleep test is indicated.
Why don't you tell us more if someone's interested in getting one of these tests? where can they go?
Okay, well, first of all, they can go to the Chilton website, or they can call the Sleep Center directly at 973-831-5351 and schedule for one of the sleep screening sessions. And that's the best way to do it, really.
Thank you so much for all this information, Dr. John Penek from Chilton Memorial Hospital. After the break, we'll have more of your hometown news. Stay with us.